Dear participants, good afternoon. It's a great pleasure to be with you during this exciting conference and to have this opportunity to present to you the findings of a publication entitled Social Work Practices in Rwanda, Indigenous and Innovative Models of Problem Solving, a research carried out by myself, Consolée Uwihangana, Mr. Alexandre Hakizamungu, Mr. Charles Rutikanga, Dr. Théogène Bangwanubusa, Mr. Charles Kalinganire, all from the Department of Social Sciences, University of Rwanda. What is the background to this research? We know that social work profession's role is to empower individuals, families, and communities, and to drive social change and sustainable development. Talking about social work, we talk about promotion of human rights and social justice without leaving behind cultural rights. Social work has been recently criticized of providing only a Western or Eurocentric perspective. So there is a call to uphold and innovate cultural values, models, and practices for development, since it was noticed that there is a scarcity of publications on African cultural values and models. So there is a need to document the cultures and traditions of African countries to lay a strong foundation for contemporary development projects and programs. A project called Promotion of Professional Social Work in East Africa towards Sustainable Impact has responded to this call. That is why this publication is available now. So, what were the study objectives? 5 objectives were set at the beginning. Identify and analyze models of indigenous social work practice, to identify and analyze models of innovative social work practice in the Rwandan society, to evaluate the extent to which indigenous or cultural specific knowledge systems are integrated into social work education and training, to identify to which extent modern Western-based models of social work practice are matched with more cultural specific approaches in both practice and training settings, and to determine the level of effectiveness of indigenous and innovative models of social work practice in addressing massive problems of poverty, vulnerability, and social exclusion. First of all, let's define the important concepts. When we talk about social work practice, we mean a process of transformation of human lives within a society and geographical setting, taking into consideration values, principles, ethics, social as well as environmental context. Then indigenous knowledge or indigenous practices refer to local knowledge or local practices unique to a given culture, society, that are based on its members' common stock of experience. So now there is a need to bridge the gap between indigenous and contemporary or modern models of practice. That is why innovative practices are needed. And when we talk about innovative practices, it means novelty, improvement, or revolution in the existing local knowledge or local practices to meet contemporary problems. In our case, when we say innovative knowledge or innovative practices in Rwanda, we mean homegrown solutions or homegrown initiatives understood as Rwanda's trademark solutions built on the Rwandan history and culture. They are meant as a direct response to economic and social challenges. We can name umuganda, ubudehe, girinka, umugoroba w'ababyeyi, marayika murinzi, inshuti z'umuryango, gacaca, and many others. What was the methodology during carrying out this research? Of course, we started by securing the research clearance and responding to other ethical requirements. The design of the research was a qualitative one, with interviews and focus group discussions as tools for data collection. The study was carried out in 8 districts. We were not able to carry it in the whole country, but we made sure it was carried out in the 4 provinces and in the city of Kigali. Participants were community members, service users, local leaders, social work practitioners, and lecturers from 2 private high learning institutions. We first contacted district officials for participants selection and also for other ethical requirements. A list of key agencies engaged in poverty reduction and social development was set. For example, institutions that are community-based ones or faith-based ones. The study was carried in rural and urban areas. 2 respondents from each institutions took part. Then we carried out also focus group discussions, community members and service users. For content validity, the data collection tools were designed through teamwork and pre-tested with 12 respondents. Adjustments were made before starting the proper data collection exercise. Ongoing editing during and after data collection were made. All audio recorded interviews and focus groups discussions were transcribed and translated in English thereafter. As we used a qualitative data analysis, thematic analysis guided the analysis, and the triangulation of information was also very important. So this is a kind of summary of the target population, methods, and sample size. 124 participants took part in the research. As findings, we refer them as to the short definition of social work, which is to help people to help themselves. Among the homegrown solutions in Rwanda, we documented 5 that are direct connected to social problem solving and poverty reduction, namely umuganda, ubudehe, girinka, umugoroba w'ababyeyi, and also inshuti z'umuryango, tubarere mu muryango, marayika murinzi, as for family strengthening and responding to family solutions. So what all those homegrown solutions have in common is that they promote togetherness, the sense of responsibility and care for one another. They are participatory based, collective action, and also foster the reduction of poverty and helping or empowering individuals and communities to find solutions themselves. So, what are the strengths and what are the gaps? First, with the strengths, indigenous models are reflected in social policy and development programs in the form of innovative models, which is a legacy of the Rwandan culture. There is great trust by the Rwandan community in both indigenous and innovative models because they are rooted, of course, in the Rwandan culture. But there are also shortcomings, neither documented nor included in the curricula of social workers or paraprofessionals. It means that those models, either in the indigenous models nor innovative models, are not included in the curricula, which leads to the implementation by professional social workers or paraprofessionals based on personal experiences and skills, not on standardized or formal training acquired from school, thus leading to imminent risks of poor implementation and poor outcomes. So, what were the conclusions and recommendations from this study? First, we noticed this positive achievement of integrating indigenous and innovative models in social policy. This is really commendable. We noticed that there is a need to integrate these models into the social work curriculum. There is a need to strengthen research collaboration to establish evidence-based facts and, of course, evidence-based practice. There is a need to place social work practitioners in key local government positions owing to their skills and their knowledge. There is a need to promote partnership between social work practitioners, educators, and researchers, as well as partnership with the local government and its stakeholders, which will lead to the promotion of university-community linkages for sharing the findings and also learning from one another, leading again to social work evidence-based research that would inform policy making, leading to proper conception and implementation of social policy programs and, of course, programs and policies. So thank you very much for your kind attention. Your feedback is most welcome.